A new report estimates nearly 70 billion pesos in annual economic losses in the Philippines linked to, guess what, mental health. Joining us today to talk about that is Yuri Marshall. He's the CEO of Mind You, which is a provider of mental health services in workplaces. Good morning, Yuri. Thanks for joining us today.
Good morning.
It's a pretty somewhat of a heavy topic that we have to discuss today because the headline figure of your report is 68.9 billion pesos, almost 70 billion pesos lost every year just due to mental health issues. Talk me through that.
Yeah, sure. Actually, that's a report from the WHO. So it estimates, that loss across different dimensions. One is direct spending from the Philippine government.
Right.
That's a combination of direct expenditure and disability payments that's issued. That's around 2.7 billion. But the remainder of the 66.2 billion is productivity loss. And so for businesses and the economy, that's lost across three dimensions. First is premature loss of life, so mortality rates. That could be, for mental health related illnesses. The second is loss of time, so absenteeism, attrition. And the last is presenteeism. So people going to work but being mentally impaired, from burnout and
That's
stress.
what presenteeism means.
Presenteeism?
I was wondering what it meant because absenteeism is pretty obvious, but presenteeism is you're there, but you're not really functioning.
Correct. So you're cognitively impaired. And so this is a high area of productivity loss, and it impacts around 0.4% of GDP.
What does it look like, presenteeism, in practice? So people workers turn up to the office, but they're not as productive as they should be. How do we measure that?
So for us, Mind You, for example, we have screenings through our services, and across 156,000 screenings, 77% of workers report high levels of fatigue, either often or always in the workplace. So that's a demonstration of the prevalence of fatigue and stress and burnout.
77% of Filipino employees that you screened reported symptoms of depression, which I thought was incredibly high. Or is that fairly normal when you compare us to similar countries?
So it's very, very high in the Philippines. It's the first time that this type of monitoring and evaluation framework has been embedded into companies. And so we've developed those systems so that companies can actually measure their productivity loss.
But 77, what's an acceptable figure then? Just to put it into context, 77% sounds really high on the face of it. But
globally, 1/3 of people are experiencing mental illnesses in the workplace caused by the workplace. So we're 40% above the average.
Wow, 40%.
Above the average, but even 30%, 1/3 is already very high. That's considered, crisis level globally. So, the push towards mental well-being support in the workplace is a global effort, and in the Philippines, we're playing catch up.
How much of that, I wonder, I don't know if you broke down the study to this level of detail, but how much of that, I wonder, can be attributed to workplace dynamics and how the company is structured versus just the overall quality of life in the Philippines?
According to our data, it's the workplace environments that have a very high level of work stress. You've got BPOs, for example. People are working outside of their normal body's circadian rhythm, so having to adapt to working in an unhealthy biological environment, let alone a high stress, high workload, high pressure environment. So other industries include banking, insurance and finance, and the education sector does look quite alarming at the moment.
Which are typically high stress environments. What other sectors showed up on your study that are worrisome?
Well, we cover 40 different industries. We've got retail, manufacturing, even transportation. So we cover companies across aviation, even on the ground, drivers. These are all high stress environments for work.
And sorry, did you say 156,000 respondents?
This is the screening data.
Right.
Yeah,
it's a lot.
That's quite a large size to basically conduct a study on.
Right. And the other figure was that 49.7%. That's what jumped out at me in your press release. 49.7 rather, almost half reported symptoms of depression. Nearly 50% experienced moderate to severe levels that may require professional intervention.
Yes.
Talk me through the demographics of that, and are they getting the help that they need?
Yeah, so what we're seeing is that people aged between 18 and 35 are the largest adopters to mental health support. And so what we've had to do is create a system where there's multiple channels and various ways to interact with the support. So we've now developed a 24/7 hotline that they can call. You've got booking sessions with psychologists and coaches. And so now we've also got education resources, mood tracking, and guided journaling. So there's a lot of different support systems available for staff.
What about the people beyond that age range? What do they do? You said 18 to 35 are the highest adopters for mental health professional services, but what do the other older people do?
You know, for everyone, so we have a catch-all type of approach. We've got webinars, leadership and management training. So one of the things that we do provide to corporate clients is the psychometric reporting. Usually that's very confusing to read. So what we do at Mind You is we laymanize it so it's easy to understand. Sometimes the stigma is being produced by the managers or even by the owners of the business.
Right, absolutely.
So, you know, for that age range, there's a lot of education, training, how to communicate with Gen Zs and millennials.
Right.
You know, we're not living in the 70s and 80s anymore. We're living through the age of AI.
Right.
We're living in the age where people are aware that they
And
require...
social media too, which brings its own mental health risks.
That's another contributor to a lot of the problems, right? And so with the growing awareness of people's valuing themselves and their health, you know, you see a lot of people adopting these new practices and available services.
But are there enough companies that institutionalize these professional support services? So to put it into context, for instance, I worked overseas for more than a decade, and that was always part and parcel of our benefits package. But here, I don't find quite so common to build it into employees' benefits package.
Yeah, you know, the Philippines, you know, does have a lot of work to do if you compare it to the developed nations. We are very young in terms of our legislation. The Mental Health Act was only, you know, imposed in 2018. And so it's only been 7 years since then. Mind You's effort in this area, we've only captured less than 0.5%, you know, of the working population. So whilst it's standard overseas, it still is a need in the Philippines. Business owners have to understand, to develop people and culture, it's not about pizza nights.
Right.
It's not about feel-good programs. You have to have evidence-based programs that tackle these productivity losses. And you can only do that when you have a measurement system in place, right? And you have to tackle all of these different demographics within your organization. Otherwise, you lose your ability to produce output. And that's really where we're suffering too.
But I guess what a lot of companies will hear when you talk about all of these evidence-based interventions is it's added costs, right? It's at a time when everyone's trying to keep their overheads tighter. Talk us through how that could happen if your resources are tight, if you're, say, medium-sized company, and there's a lot of them here, right? 99% of the economy is about SMEs.
You know, the belief that it is a cost is a malaligned understanding of the mathematics around, you know, the economics that run the business. If you look at the WHO report, the productivity losses are in the billions of pesos. I go back to the 3 dimensions: premature loss of life,
Right.
loss of time, attrition, the cost of having to replace a staff member, retrain them. These are all invisible costs that they don't necessarily see in your
Right.
standard HR dashboards.
Yeah.
Once you start to attach this international level of metrics and you can measure productivity, embed evidence-based programs that really do carefully look at people's health, right? Because well-being is a connection between your mental health, your biological health, and your social environment. You can't just use the old HMO paradigm, physical health only, band-aid solutions, reactive care. It's got to be preventative. You know, if Philippines is to compete in the region, we have to look at this area of care.
Right, absolutely. I think you're absolutely right. I don't think many people look into, or actually are as far ahead as computing the productivity losses on the other side of it, with presenteeism, attrition, premature loss of life, the dimensions that you talked about. But what are some of these evidence-based interventions that you guys offer?
So there's talk therapy. We don't just operate in the realm of psychological talk therapy. We now have coaching. We also have a 24/7 hotline. We promote mood tracking, guided journaling, and self-education. So we have a resource hub where people can learn about breathing, meditation, moving the body, nutrition. These are all elements that contribute to your stress. And when you're feeling stressed, it can make you sick. So people ignore that. They think that the lever for sickness is, some bug or some virus that's going around, not realizing the buildup of chronic stress, the lack of being able to release these emotions is causing them to not be able to show up at work. And so, this is an area that requires focus, attention, and a lot of science and data.
What does attrition look like in the Philippines as far as you know, at least based on the ones that you've surveyed?
According to our data and WHO, since the pandemic, it's increased by 176%.
176?
Yes.
That's incredible in a bad way. That's outrageous.
I think it's also compounded by the fact that there's a lot of available online jobs now. People are looking at e-commerce platforms. Because they value their health, they can go to employers that have a better environment to work in. And so, I think if we start looking at the data, that's going to be the place that informs us to make better decisions.
And so people are looking for more flexible jobs, in essence, right? They want to be able to stay at home, I suppose, to be with their families, and they're looking for to become to have more control over their own time. Is that correct?
Well, I don't want to make any assumptions. I think it depends on the industry and the need for the type of work. But you can comfortably say that amongst Gen Zs and millennials, there is a preference for hybrid, remote working. But from what I see over the last 5 years, across a whole of society approach, there needs to be a support system that catches everybody.
Right. How can policy help in this scenario? And by that, we have to look at it from a more pragmatic lens, right? The lawmakers, Congress is already have their plates more than full with all the other issues that we're grappling with. What's a reasonable policy to introduce here in order to, push us along the right direction?
There is already an established Mental Health Act. The next step will be a regulator to ensure that there is compliance with the Act, right? So there are some mechanisms in place. That there are, proposed DOLE penalties for companies that don't have a mental health policy.
But it's not being tracked? It's not being monitored?
I think the regulatory activity for compliance is lacking. It requires some effort there from government. I also see PhilHealth release packages available in the mental health space. One package is 9,000 pesos with an additional extension of 15,000 for those that really require support. But the problem I see there, I think that's a starting point. Out-of-pocket expense for people is a real problem. If you're going to be spending money outside of your monthly income, people generally have to take care of their living expenses, putting food on the table.
Exactly.
So, that mechanism for disbursement of those PhilHealth funds is being held back right now because of a lack of technology, because the payback is 90 days plus. So until such time there is a technology solution to shorten that period of reimbursement, then that's where you start to see a wider adoption.
And so we need an independent regulator, essentially, to look into compliance with the Mental Health Act.
Which is DOLE.
We don't need to introduce a new law at this point, is what you're thinking.
Well, the law is quite new, 2018. I do have some recommendations for the evolution of that piece of legislation, given my background. But before doing that, the real effort on the ground for companies to take care of their staff beyond standard minimum viable HMO and EAP. They need to pay attention to that. Otherwise, your business output and your bottom line's seriously going to be affected by it.
Yeah, I think you're absolutely right. I haven't heard of any, at least the major ones that have taken effort to comply with the Mental Health Act. But mental health, according to your press release, is the silent profit leak. This is my last question to you. Talk us through that and what companies can do immediately beyond compliance with the law.
It's the largest profit leak in the country, I believe, because there's a lack of metrics. So even being able to evaluate the right mental well-being partner, there's a lack of knowledge around that. Right? So seeing reporting that's validated, that you can rely on, that your business can rely on, is very important. So, you know, my push is you have to follow those that are leading this space.
Right.
You know, the clients that we have really paid attention to the data reporting systems, the data privacy.
Right.
It's psychological safety and economic prosperity. They need to work hand in hand.
That's such great advice. You can't fix what you can't measure. We'll leave it at that. Thank you so much for talking to us today.
Thank you.
That was Yuri Marshall, CEO of Mind You, a mental health services provider.